Here, I'm going to talk about the NCLEX previous year question and answer, and this collected question from NCSBN, which is the leading regulatory nursing board. So this question about the psychosocial integrity. The question number 1, which relaxation strategy would be effective for a school-age child to use during the painful procedure? So this question about the age specific care, right? So if any patient undergo to the painful procedure, school age child, which is good for relaxation strategy, effective for school age group. Number 1, having the child keep his eye shut at all the times. So it is not a logical or not a scientific that I'm going to start a procedure and close your eye all the time. And having the child hold his breath and not ill. So number 1 and number 2 does not make any sense, right? It is not a scientific. So definitely 1 and 2 is not a answer. Number 3, having the child take a deep breath and blow it up until hold to stop. And number 4, being honest with the child and telling him the procedure will hurt a lot. So number 4 is never an answer, because whatever the procedure, if I say as a healthcare provider, the procedure hurt you a lot, it is not a therapeutic way to communicate with the patient, and your patient will be afraid about the procedure, right? So number 4 is never answer. Now 1 and 2 I already explained, and number 3 is only one option where the breathing techniques relax. So if you know how to control the breathing, it can help you. So what is their explanation? So they said, having the child take a deep breath and blow it out until told to stop. What is rationale? Having the child take a deep breath and blow it out is a form of distraction and will help the child cope better with the procedure. So it is the coping mechanism. A child may prefer to keep his eyes open or not shut during the procedure so he can see what is going on and can anticipate what is going to happen. Letting a child during the procedure is a form of helpful distraction. In addition, holding the breath is not beneficial or could have adverse effect. So, helpful this addition. Now, the nurse should prepare the child for a procedure by using non-pain description and not suggesting pain. For example, the nurse might say something this feel like something pushing or striking, or sometimes it does not bother the child at all. What next question? So a child is brought to the facility in an agitated state and admitted to the psychiatric unit for observation and treatment. While putting personal items away, the client talks rapidly and folds and unfolds garments several times. And he cannot seem to settle down which nursing diagnosis is most applicable at this time, right? So first of all, the keyword, my client brought to the facility and hesitated and admitted to psychiatric unit. And we observing and give the treatment. So psychiatry means mental related. So while putting personal items away, client is anxiety increase, worried about this, right? So now what we could do, my patient's anxiety, under anxiety. So which nursing diagnosis is most appropriate at this time? Disturb personal identity. Definitely it is not related to the personal identity, right? Or anxiety. Yes, my patient thinking only his stuffs, folding or unfolding, is it why it is away from him? So it is worried because of anxiety. Number three, compromised family coping. Never it is. It is not a compromised family coping. Nothing related to coping or powerlessness. So if you read this question, it is definitely related to the anxiety oriented. So why? What is the rationale? So anxiety is the most applicable nursing diagnosis at this time because the client behavior mimics some of the objective sign of anxiety, which include patient is restlessness, irritabilities, rapid speech, inability to complete the tasks, also verbal expression of tension. Disturbed person identity or compromised family coping or powerlessness would be premature diagnosis because the nurse has not had opportunity to complete a thorough nursing assessment. So if you read this scenario, it is easily reflect the patient has an anxiety problem. The keyword here, psychiatry, patient is irritable, agitated, restless, and also patient is worried about because personal items away, talking rapidly, so rapid speech, talkativeness, right? Several times it reflects the patient has an anxiety problem. Next, so which statement accurately describe therapeutic communication? So there are four options. Which option make understand the best way of communication? Like offering advice, your opinion. So definitely offering advice is not a therapeutic way of talk. I can't say my personal opinion to my patient. Not verbalize your feelings, right? So if anything logical to the patient or patient treatment option, their caring procedure, I will verbalize. Or if patient want to say something, allow them to verbalize. So it is verbalization is the best way of communication. Avoiding advice, judgment, false reassurance, and approval. Right? So number one, I explain why not an answer. Number two, I explain why not an answer. And number three, avoid. Definitely nobody like to give all the time advice. Or don't judgment your patient by your personal judgment. Don't do this. You will be fair to all, equal to all. You have to maintain the principle of ethics. Also, what is true, just tell it to them. So don't give false reassurance. If your patient has a terminal disease, cancer, you don't say you are going to okay, right? Or also approval. So number three is the best option. Telling the client how to cope. We can do this, but they said describe accurate therapeutic way of communication. Number three, why? The goal of therapeutic communication is to help the client develop insight and skill to solve his own problems. The nurse can achieve this goal by avoiding advice, avoid the judgment, avoid the false reassurance, and also approval. Pointing out mistake can make a client defensive. The client-nurse relationship is not the situation in which the nurse should offer advice or any personal opinion, nor is it the situation in which the nurse should verbalize her own feelings. The client needs assistance in developing coping skill or not someone to solve his problem for him. Next question here. A nurse is working with the family of a client who has Alzheimer's disease. The nurse noted that the client's spouse is too exhausted to continue providing care alone. Adult children live too far away to provide the relief on a weekly basis. Which nursing intervention would be most helpful? Select all. So keyword here, Alzheimer's disease. And spouse is exhausted because only one person how to take care 24 hours a day, 7 days a week. And also the adult children far away. In that scenario, which is the nursing intervention would be most helpful? Select all, right? Sometimes we will get this type of question in our NCLEX board. So it is important to give a concentration and find it out your accurate answer. Calling a family meeting to tell the absence the children that they must participate in helpful the client. So you as a healthcare provider, you can say they must. Nobody know about the future. How we can pressurize them that you must participate. So it is not a best way to approach. Number two, suggesting spouse look for psychological counseling to help her coping with exhaustion. So it is good, you can talk, you can advise them, go for the psychological counseling, but I believe it is not enough to reduce the exhaustion, or it is not a way to solve the problem. It is not the solving the counseling. This is the question, who will be there with the patient in absence of spouse. So number two, also not a good choice. Recommending community resources for adult care. So it is good adult care. Nobody is at the family. We go for the adult care. If it is children, children care. So they can help you. So it is a good choice. So number 3 is a one answer. Encouraging the spouse to talk about the difficulties involved with caring for loved one who has Alzheimer. So we encouraging, so they can verbalize, they can sharing their ideas, they can talk about the problem and difficulties and find out the solution. So when the problem is there, solution will be there too. So it is a good choice to talk. Asking whether the friends or any religious place or members can help. Yes, it is a good choice too, right? So resources. Sometimes somebody come as a volunteer and help. So number 5, also the good option and helpful too. Number 6, recommending that the client is placed in a long-term care. No, we can't say this. If the spouse want to bring or continue the life at the home, that should be good. We can't say they'll go for the long-term care facilities. So best option 3, 4, and 5. Also, let me read their explanation. So rationale, many community service exist for Alzheimer client and their families. Use of these resources may make it possible for the client to stay at home and also alleviate the spouse exertion. The nurse can also support the caregiver by using her to talk about the difficulties. And also, she's facing is caring for her spouse. So the difficulty what she faced. Friends and any people from the religious space may be able to help in providing care to that client, allowing the caregiver time for rest, for exercise, and any enjoyable activities. A family meeting to tell the children to participate more would probably be ineffective or may evoke angry or feeling guilty. Counseling might be helpful, but it would not alleviate the caregiver physical exertion or would not address the client's immediate needs. A long-term care facilities is not an option until the family is ready to make and to solve this problem. Next question here, a client with hypothyroidism and is afraid of needle and does not want to have his blood drawn. What should the nurse say to help alleviate his concern? The question answer I'm discussing, it is psychological integrity, one of the part of your NCLEX board exam. It is not for the adult health. Our patient is diagnosed hypothyroidism, thyroid disease, afraid of needle and does not want to have his blood drawn. What should the nurse say to help alleviate this concern? The 4 options. Let me see which one is the answer. Number 1, when your thyroid levels are stable, we would not have to draw your blood as often. So number 1 is does not make any sense because you are talking something in future. It is not a therapeutic way. Number 2, it is only little stake. will be over before you know that. It is false reassurance. You do not know. Maybe the healthcare provider need 2 times. Number 3, the physician has ordered this test, so you can get better soon. It is not also the healthcare provider therapeutic way to communicate the patient. You have to do. Number 4, I will stay here with you while the technician draw your blood. So first of all, the healthcare provider or nurses with the patient, we have to make a trustable relationship. When your patient is depends on you, then you can reassurance that I will be with you, right? So it at least helpful for your patient. They will get hard to go next. So I will stay. So number 4 is the answer. Why? What is the rationale? The nurse should tell the client that she will stay with him blood is as the blood is drawing or draw. This response provides the client with reassurance. The presence of a nurse and enhance the therapeutic alliance and possible providing a greater opportunities to educate the child. Although telling the client that blood would not need to draw is often when thyroid level are stable provides the client with a rationale for needling blood draw. So saying that the procedure will be over quickly or that physician has ordered the blood draw and ignore the client's standard fear. So it said it is not a way to reassurance our patient. Next question here. When assessing or assessment a family suspected of abusing its 4-year-old child, which behavior is the most important that would suggest abuse? So there are 4 options. My patient is 4 years old. Which behavior the most important that would suggest maybe abuse? Number 1, attempt by the child to define or verify what the parents state. Number 2, incompatibility between the history and the injuries. Number 3, responsibility taken by child for the act. A complaint other than the one associated with the sign of abuse. So there are 4 options. Number 2 and number 3 may be the answer. Number 1 and 2 is not answer because it does not make sense. So number 4, a client other than the one associated with the sign of abuse. It is very good choice. Sign of abuse. So complain other than. But number 4 is good choice. But number 2, incompatibilities between the history and sign. So number 4 included in number 2, even little bit more information. The giving the history, because the 4-year-old, boy or girl don't want to say anything against their family member. is a healthcare provider, if we get something evidence, we will try to find out the clues. So what patient giving the history, it does not adjust with the injury I got. So maybe I got some mark or any bodily injury, any unusual location on the body, right? So if a children 4 years old went to the school and was playing soccer with others, suddenly fall and broken the hand, it is normal. But if patients say, okay, I went to the school, I was playing soccer or football with my classmate, suddenly I fall and I have a two red spot in my buttock or over my um, shoulder. So it is unlike with the history you a patient gave. So maybe we need to check something more. So history taking, and what I found, it is not same incompatibilities in between history and injury. Definitely important clause for abuse. So what is their rationale? The most important, sign of abuse, which based on decision for reporting suspected cases or suspected abuse, is an incompatibilities between history and injury. So usually the child will very uncommon the battery his parents. So something abnormal, touch without permission. So it is, or by saying he has been abused, or will, or instant, or attempt to define a parent's action or verify the story. The child may even take responsibilities for the act in attempt to victimized. Or however, this factor are not as important as an incompatibility between history and injuries. So a complaint other than the one associated with the sign of abuse, it is also a concerned or warning sign of abuse, but is not the most important, right? So what next? Here, a mother asks the nurse how to handle her 4 years old child, and those recently start get wet the pant after being completely toilet trained. So 4 years child being complete toilet trained, how to use the toilet, how to poo or defecation, but suddenly started get wet the pant. Which child just one day or started, the child just started attending nursery school 2 days per week. So a 4 years child suddenly start the school, maybe they are worried, they have anxiety, maybe, right? Which statement by the mother indicate understanding of the situation. My child hates school. My child is pushing me for sending him away for a few hours. And child is most likely regressing back to a behavior that is increase his sense of securities. So this is the sentence or statement by the mother indicate understanding of the situation. Number 4, they said he must have inherited this from the husband. So it does not make any sense, right? Number four. So number three is a good option or our choice. Why we choose number three? This statement about the regression indicate understanding because the stress of starting nursery school may trigger a return to a leap of successful behavior from earlier stages of development. The child's skill remain intact, although increased stress may prevent the child from using the skill. The child's behavior is not an indication that he hates school or wants to push the mother, or regression is not the trait that can be inherited. So number four is not an answer, and we chose number three.